Hey, sir, I'm Officer Heisman, Louisville Metro Police Department. It's called. What's going on today?
My son is dead upstairs.
Okay, you mind showing me?
Sure.
Self-inflicted injuries that lead to death can take many forms, but in youth, drug overdose is a common method. If firearms are involved, police will be the first responders to enter the scene in order to assure the safety of everyone involved. As you might imagine, such scenes will be chaotic and require your calm and comforting presence to assist the family.
Sir, do you mind if I sit?
No, that's fine.
Okay. Can I get you all anything? Any water or anything? I'm sorry for what's happened. If you don't mind, can I ask you a couple questions?
Sure.
What was his name?
Sean.
Sean? When was Sean born?
March 10th, 98.
Okay. Did he have any type of problem or issue, maybe with depression or any type of medical conditions that were going on here shortly or lately in the past?
We've had some challenges with him this year, yeah.
Okay, was it at school or out with the neighbors or?
School.
Did you know if anything that he was possibly taking any type of medication or anything? Okay. Sir, if you don't mind, can I take them and show him where your son is? And I'll be right back. If you don't mind, can you look? My partner's coming. He'll be here shortly. Thank you.
When speaking to the family, mirror the position of the person that you're talking to. If they are sitting, sit with them. If they are standing, stand with them. Try to avoid standing over someone who is seated. Meet them at eye level. Even while gathering information, speak compassionately. Ask for and use the names of the parents and the child who has died. Express condolences for what has happened. Tell the family what will be happening next and what they can expect. For example, the coroner will come soon and Bobby will be taken to the medical examiner's office. This is a normal part of the investigation so that we can more fully understand what happened. The parents may wish to spend time with their child. They may want to touch or hold them. Any contact will need to be approved by the coroner. If the coroner allows the family to be with their child, prepare them for what they might see. There are other things you can do to support the family. You might offer to call their spiritual support, or friends and family who can come to care for them. Sometimes even a cup of water can make a difference to the parents.
The pills and medicine that I found that was next to him, did that belong to him?
I don't think so.
Okay. All right. Is there anything I could do for y'all? Friends or neighbors or somebody I can call? Come over.
No, you've done
What
fine,
about
thank you.
preacher, pastor?
We'll call her.
Okay.
Thank you.
Okay, just want to make sure. I'm sorry for y'all's loss.
I'm Paramedic Durham. This is Paramedic Thompson. We're with Louisville Metro EMS. Your son's name was Sean, correct?
That's right.
Okay. Apparently, from what we can see upstairs, Sean is overdosed. Sean is dead. Everything that we could have done has been done. There's nothing further we can do. Okay? There's going to be some steps that are going to happen here. We'll remain here with you. We're going to notify the coroner. He's going to come out. He's going to investigate it. It is a crime scene. Once he's done, you all will be able to go and see him, okay? If you'd like there, or we can arrange something a little bit, as comfortable as possible for you all. All right? Would you like anything to drink? Anything we can do? Contact clergymen for you or anything?
No, thank you.
Okay.
Can we go up?
Not right now, okay? We need to wait. It is technically a crime scene with Louisville. If there is a death, they want to investigate it completely prior to that, okay? But once that's done, though, we can. You will be able to see him soon, just not right away, okay?
He seemed so happy.
Well,
Last few days he was
He
happy.
did.
we don't know why sometimes these things happen. They just do. I hate to say that, okay? But I will remain here, my partner will remain here with you, and do everything we can to comfort you, okay?
Sure, thank you.
Because the family may be interviewed by EMS workers, police, and the coroner, it may feel to them that the questions are repetitive. That's okay, because details that were missing in one telling of the story may emerge in later versions. When gathering information, be sure to offer your condolences for the child's death. Always use the child's name. Use concrete language when speaking of the child's death by using the words dead and died. It is common to use words like okay and all right repetitively when you're having difficult conversations. Parents will seek to make sense of their child's death. Sometimes they will feel guilty, especially when the death is a suicide. It may be tempting to comfort the family and try to take away a sense of self-blame by saying, "These things just happen." Unfortunately, this can come across as being dismissive and unfeeling. Typically, parents aren't looking for an answer at a time like this, but are expressing their dismay and shock at what happened. When interviewed in the months following a child's death, many parents report that what they remember most about their encounter with first responders is how they were made to feel. The compassion that you show or don't show to a family can affect their well-being in the months and years to come. Physical touch may be appropriate, but be sure to take your cue from the family. If it feels awkward to you, it will likely feel awkward to the family. There are things that people say at a time like this that, while meant to be comforting, often have the opposite effect. Things like, "I know exactly how you feel." "She's in a better place." "At least you have or can have other children," can be seen as attempts to make meaning of the parent's experience for them. One way to be comforting can be to ask about the child. What was he like? What was she like? Perhaps the best thing you can say is, "I don't know what you're feeling, but I am here for you and willing to listen." How you say this is very important. If said without compassion, it can seem unfeeling. If you say it, mean it. Listen to what the parents have to say without judging or reacting negatively to what you hear. Remember, the compassion that you show the family can make all the difference.